So my program of research mainly focuses on how sex changes for women as they move through midlife and into older age. So for the study that I'm presenting at this particular meeting, we did interviews and focus groups with women between the ages of 45 and 60 to try to get an idea from them in their own words what their experience of changes in sexual function was during their midlife years. And so we found a few interesting things. Not surprisingly, there were a number of women who discussed negative changes in sexual function as they got older. These included things like vaginal dryness, difficulties with libido, taking longer to orgasm, and that's been seen in prior work as well, so that wasn't necessarily surprising to us. We were more surprised to find that there were also women who definitely experienced positive changes in sexual function as they moved through their 40s and 50s. So I think as doctors, we often assume that it's all doom and gloom, sex goes down the tubes as you got older, and a lot of women were telling us that that wasn't necessarily the case for them. So there were several things that women talked about. They said as they got older, they felt more comfortable in their own skin and more confident. And they also felt like they knew their own bodies better, and this allowed them to express that to their partners and make for a better sexual experience as they got older compared to when they were younger. The other thing we found is that while some women did experience negative changes in sexual function, they found ways to adapt to that. So they adapted to these changes either by changing their sexual behaviors or by putting different priorities on different aspects of sex. So in terms of sexual behavior, women talked about using lubricants to help with vaginal dryness. They talked about trying different types of sexual activity or longer foreplay to help with arousal issues. And then they also talked about how as they got older, the emotional aspects of sex became more important to them than the physical aspects. So women said, when I was younger, the goal used to always be like both people reaching orgasm. Now that I'm a little bit older, the intimacy and the closeness is the more important part of sex for me. Sexuality is not just a biologic phenomenon, but also interpersonal factors such as what's your relationship with your partner, sociocultural factors such as what's the role of sex in your particular race or religion, as well as those psychological factors that you discussed like sleep issues, anxiety, depression. These all become more common during menopause and can affect sex as well. So as a researcher, as a clinician, and as an educator, I try to encourage people to take what we call a biopsychosocial approach to sexual problems and not just focus solely on the hormones and what's going on biologically, but also what's going on more holistically. So one of the things I'm interested in my program of research is as there's been increased interest on sexual problems in women over the last decade or two, providers and researchers are becoming more aware that a lot of women experience sexual problems and are looking for solutions. I'm interested in developing non-pharmaceutical treatments for sexual problems in women, so women have options in terms of choosing between pharmaceutical treatments versus more behaviorally oriented treatments. So that's where my program of research is going. Oh wow. It's always hard to choose just a few, but there is a big emphasis on vulvovaginal sexual urinary health, which I think is a big issue for women as they move through these years. We're hearing a lot of talks about vaginal dryness and treatment for that, pain with sex, vaginal microbiome. So I think that's been one of the big themes this year. So one of the things that several of the talks here at NAMS this year has highlighted is that there are treatments available for these types of problems in women, but women often don't know that. And oftentimes women aren't bringing it up in their doctor's visits, and the doctor's not bringing it up either. And a lot of women don't realize that there are good, safe, effective options for treating vaginal dryness or sexual problems during the midlife years. So I hope that providers and patients alike feel more empowered to speak up about these issues in doctors' visits.